Victims are not just those who are physically injured, but also those who were present and may be experiencing emotional distress.
Well, that's the message from the FBI and DPS today during an update on the deadly mass shooting at a shopping mall in Allen, Texas. More than 100 people and 30 families have been provided with victim services. And the FBI is now reaching out to any other victims of the shooting that left 8 people dead, including children. Well, it's common to feel distress and hopelessness after a mass shooting like the deadly rampage in Allen. But talking about it can help. There's a disaster distress helpline. It's free and takes calls 24/7. And we have that number there on the bottom of your screen if you would like to call. Federal dollars funded, and it's run by nonprofit Vibrant. And joining us this afternoon is Dr. April Naturale, the Assistant Vice President of National Crisis and Wellness Programs at Vibrant. Dr. April, first of all, thank you so much for joining us this afternoon.
Well, thank you for giving us an opportunity to let people know about the Disaster Distress Helpline, Jennifer.
So we, as you have been following, we have seen a lot of tragedies in the state of Texas just over the past week. How does this helpline really help those who are impacted directly and indirectly by these tragedies that we've been facing?
Well, Jennifer, whether this happens in a mall, on the sidewalk, in a school, we know that the entire community of the area is affected. There are so many people who are feeling unsafe with all of the incidents that have been happening. And the Disaster Distress Helpline is available 24/7 because we do know that many people may have been in some other kind of an incident, in addition to being activated or very emotionally distressed, as we all are when seeing these incidents. We do know that talking to someone to help people to understand they're not alone, first of all, and that many people may be feeling some of the distress, that with good coping, good social supports, that people can start to feel a little bit better. But very often people think that there's something wrong with them, that they're going to develop a major mental illness, rather than recognizing that, of course, we're going to have a negative reaction and be upset because of these incidents as human beings, as those who care for each other. And talking to one of the crisis counselors can help people get through that understanding and also access some of the local resources that they may want to reach out to in their own communities.
Okay, and I like that you touched on that because something that I found that was very important, it's not just an initial call. Your counselors actually help with just a path to recovery for people who have been impacted and who call them.
That's correct. We may have people who are experiencing, remembering an event that happened to them previously, or they may be on a recovery path 6 months out, a year out, or 2 years out, and want to talk to someone about some reoccurrence of their symptoms and how to get through that. And that's why we're available all the time, anyone in the country and in the U.S. territories, by the telephone number and the text to be able to address some of the concerns that people have when they reach out to us.
And there's also an online peer support community that you all offer. How does that offer support to people who have been impacted?
Well, as you might know, Jennifer, peer support is emerging in the research as one of the best ways that people can help each other. Someone who's already had the experience knows what to expect and what helped them the most, and they can listen to and share, having had the lived experience, share what was helpful to them, and get an idea of, what might be the path coming forward. That people get very upset if they don't know what to expect. And so sometimes sharing, well, this is what we went through, or this is what we know can happen, especially as you reach dates like the first year of the event that's happened, or maybe a holiday just after an event or a birthday, that people can get activated. So the peer support folks it's a very large community. Actually, you can go online to our Disaster Distress Helpline peer support community. There is one specifically for people who have experienced a mass violence event. And we have trained peer supporters who can speak to those who are in the room, in the community, and help them to share experiences incidences in a way that we know has been helpful to others who are going through this.
And as we've covered, there certainly is a growing need for mental health resources, not just in the state of Texas, but really across our country. And some hotlines that we even have here, they are experiencing backlog as well as the need for just mental health professionals to staff those call centers. Is that something you all are seeing? Are you seeing that because of the need that's out there?
Actually, in July of this year, the federal government provided Vibrant with the ability to launch 988, which is used to be called the National Suicide Prevention Lifeline, and it's now the 988 Suicide and Crisis Line. And that's a network of over 206 crisis centers across the country. We have a large number of backup centers, centers that work directly with folks who speak Spanish, folks from the LGBTQ community. And so we have really built up our capacity to answer the calls. And we know that there is usually a surge of calls after incidents like this. And so the crisis centers actually staff for that. They know that something has happened. And so they move staff around and bring them in at certain times when we know there are increases in calls. So we are able to answer the calls. We answer them in a very short period of time. And we do urge people to continue to use the line. We don't expect that we will not be able to answer them timely because we have planned for expanding, unfortunately, the need for, as you said, the need for the services here with suicide rates going up as well as an increase in natural and human caused events. And so we are prepared to take calls from people across the country.
And then lastly, just according to your website, you all launched back in 2012. I know there's been a growing need, but can you talk about why you launched, and was that because of a certain event or was that specifically because of the need that you saw?
That's an interesting question, Jennifer. What we saw was that after Hurricane Katrina, the National Suicide Prevention Lifeline was utilized as a primary line for people to call and get help because the people who evacuated from the Hurricane Katrina areas in the Gulf Coast went to all over the country, 33 states, and five of the states very highly impacted. And what we found was that people were glad to have a number of calls, but some of them felt like they were confused. They said, I'm not suicidal, but I need to talk to somebody about what's happened. And so the federal government, the Substance Abuse and Mental Health Services Administration, decided to launch the Disaster Distress Helpline because of the increasing number of these types of incidents and helping people to understand that they may be in distress. It may not be a suicidal crisis. And so that's why the Disaster Distress Helpline was launched in 2011, and it continues to grow, unfortunately.
Okay, all right. Well, thank you so much for being with us. And again, to our viewers at home, the number there on your screen, we'll also have that on our website at kxan.com.